my agenda this morning is just to give an introduction of this important topic, which I think I didn't even mention, that it's significance of laboratory exams in assessment of acquisition of laboratory medicine competencies in preclinical years. So I will start by introduction, then a few publications that support this, and then I will give an example of what we do in Moi University School of Medicine, and maybe summary, and maybe just a few takeaways. The first thing, of course, is to start by a few definitions. One, of course, is significance, which implies a quality or a character that should mark practical exams as important, but is not evident. And I think the next slide will show that actually this is not used as much as it should. The other thing is, of course, competence, which is skills, strengths for particular duty. For medical students, this means to have to possess qualities and demonstrate the attributes necessary to recognize and diagnose disease process. And so most the students must have sufficient medical knowledge, acquire critical thinking skills, skills in performing clinical laboratory procedures, and engage in lifelong learning. This slide is actually done by Mackenzie J. White and colleagues, and it was evaluation of competence-based medical education in sub-Saharan Africa. And I think it's important to note that there are more than 170 medical schools in the region. And if you look at the main findings in this study, was that tutorial problems and tutorial-based learning. Of course, this slide is just strategies in assessment and teaching. So here we are talking about tutorial problem-based learning, report, then practical assessments, clinical, or what I wanted to highlight, of course, is the use of practicals, which you can see in preclinical years. The dark line is only 46% in the universities that were assessed. And most of the universities use just summative written assessments, and you can see it's 100%, and progressive or cuts in 100% of the cases. This is important because majority of the universities actually are not using practical exams as a form of assessment. The next one, of course, is the importance of objective structured practical evaluation, or OSPE, which was derived from objective OSCE and modified by Eden in 1975 to 1979. In an international conference in Ottawa in 1985, OSCE and OSPE were introduced as teaching and evaluation tools, and its advantages were compared with the disadvantages. Our OSPE are now considered as a gold standard for assessing competencies in preclinical and clinical laboratory skills. There are several publications that have, of course, confirmed this, but I think the use of OSPE is not very common in our universities. One other study is by Lacombe and Aretali. This is from India, and that is the abstract, but I will just highlight the findings where they were comparing objective structured practical examination as a tool for formative assessment of practical compared to the tutorial, compared to the traditional practical exams. And when they evaluated using OSPE, students obtained better, higher significant mean marks compared to the traditional ways of practical assessments. A PAT test of P equals 0.001 confirmed this, whatever. And the student feedback indicated agreement in 92%, and the teachers expressed an unanimous agreement that OSPE is a more comprehensive evaluation tool than the traditional practical exams. Then the majority of the teachers believe OSPE should be incorporated in future exams. The next one is Rachel et al. This was done in 2009, and she was also looking at comparing OSPE and traditional practical exams. And she found that plotting between a Planck-Hartmann plot showed 63% of the students show performance that was within the acceptable range. What they said was acceptable within the acceptable limit. This usually Planck-Hartmann method are usually used to determine whether you can use a new method or not. And if most of the bias or the difference between the means fall in the acceptable range, then this is a very good method of to replace the traditional practical ways. Then our own publication that we did in 2012, where we were looking at, in Moi University we teach pathology across 5 pathology departments. It's hematology, anatomic pathology, microbiology, biochemistry, and immunology. And we are looking at these students who are not integrating between these departments. So we use technology to integrate across these departments, and we found it was a very good thing for the students, but that was 2012. So as a way of medical knowledge, as we know, is that it is a practical way of knowing where and when, what is the cause, evolution of the disease process, structural changes, symptomatology, diagnosis and treatment, prognosis and prevention. I want to highlight the fact that pathology plays a very key role in the medical knowledge, and this is a practical thing. Pathology is a practical thing. So without practical assessment, it's very difficult to actually assess whatever in pathology training. This slide is highlighting the fact that it is not, the assessment is not just one on its own. It's a planning process where the first thing we do is, of course, develop the learning outcomes that we want the students to learn. This is to know what the students should be able to do at the end of the course. Then we, of course, have learning strategies and teaching strategies that we'll implement in this course. Then assessment strategies that we may choose. But a very important part which is not usually assessed, which you don't usually do a lot, is the assessment criteria, which is how do you know that the students have actually gotten the outcomes that you wanted them to have. So I will highlight a few things about the assessment criteria, and it is assessments of the key characteristics of performance in the assessment task, and it explains how student responses to assessment should be evaluated. Usually they are in three things: knowledge-based, application-based, and skills-based. What the students should be able to do, and the knowledge you want the students to have. And then, of course, so these are the statements that you need to make before an assessment is given. So the important characteristics of assessments that I think is good to highlight is that there must be alignment between the learning outcomes and the assessment that you are going to give to students. Because if you don't have alignment, then of course you will have what we call hidden curriculum. And students learn through assessment. And if they have the wrong assessments, then they will not learn what you wanted them to learn, but they will now learn what you are trying to assess. So then they should be fair. Assessment should be fair within the progression of the students, and then it should be a transparent process. Students must know, should be given exactly what they should be expected to have at the end of either the course or at the end of the year. And then, of course, there should be constructive feedback once the continuous assessments are given. These are formative assessments. Then the faculty must be supportive in utilizing the most optimal assessment methods. Of course, I suppose this is the reason why this conference is here, that we learn how to utilize the most optimal assessment methods and should have knowledge and skills to develop valid assessments. As I've mentioned at the beginning, that the cornerstone of competence-based medical education is robust, valid, and reliable assessment. So I think this is, an important conference where we learn these things. So I would just want to look at one assessment criteria just to highlight what I was talking about. Remember the other things, the outcomes, the strategies to teach, and assessment strategies are usually common, and they are in the curriculum. But I think this assessment criteria is where there is a lot of problems. So this course, I think, for the pathologists in the group, these are common course in general pathology, and it has a few learning outcomes which I have highlighted there. So if you are to do an assessment criteria for this particular course. Usually, what we usually write for the students, and they should have this, is that they should have, at the end of the course, you will have a CAT, or a summative assessment at the end of the course, where you'll be tested on the knowledge, what you've learned. Then you'll also be tested on your understanding, whether you've understood the topic, and then the application of that knowledge by being able to recognize the changes following cell injury. And here it will be a practical assessment, where you'll be given maybe, I'll show you some of them, hypertrophic heart, maybe atrophic kidney. So these are practical aspects, but it is application of that knowledge. And then we tell the students, of course, they must pass at least 50% of the questions correctly to pass. And then maybe this is a standard, because this is the criteria down there. And they must get 65% to get a credit, and over 75% to get a distinction. This should be available for the students so that they know exactly what they must do before they start. So what are we testing? Of course, the cognitive processes of testing is to recall the information, the knowledge that you have given. So they must be able to recall, then understand or construct the meaning from all the things that we have given, and finally to apply that knowledge in the assessments that we are going to give. So I'll go to our case in Moi University School of Medicine, and I'll use the course of general pathology, which is 6 units. And these are the learning outcomes for that course. And I will just go down to the content for the course. And here I want to highlight the fact that this course is taught by several departments. As I mentioned before, the anatomic pathology, microbiology, immunology, pharmacology, and biochemistry. These courses, and these are the content for each of the departments. Of course, as you realize, maybe anatomic pathology teaches more than immunology and pharmacology. So there has to be a weighting between the departments. And this course is usually delivered by overviews, tutorials, and practical assessments. And then, of course, a written cut at the end of the course. So we have to weight the different contributions by the departments, and this is usually developed during the curriculum development. And anatomic pathology gives about 50% of the course, where hematology, biochemistry, microbiology, and the rest actually give some percentage. And so this is distributed both for the practical sessions and also the written exams. And if you look at the stations for anatomic pathology, there are 4, hematology 1, biochemistry 1, microbiology 1, immunology 1. Then pharmacology doesn't have any practical. So this is the weighting because of the fact that it is contributed by several departments. I'll give an example of a question where this is from anatomic pathology, where this is a station in the end of year practical exam. And we have a gross specimen that we usually give the students. And the first thing, of course, is to recognize, the recall. And then the next thing, of course, to describe the pathology, the understanding of what they have learned, and then application. List 3 courses of this pathology. The other department, biochemistry, usually gives also 1 spot exam. For this particular case, it was spot R, and this was a printout of renal function tests. And the students was to indicate what are the normal ranges for this test, and identify the values that were out of range. Then microbiology will have a spot also, where there is a section of hematobium they are supposed to recognize, and then state the medical importance of this parasite and complications associated with it. This is the application of the learning process. Then immunology is given also a spot where this particular question had 2 test kits, and the students were to answer. The answers were given as MCQ, and they were to take the correct answer. Then hematology had a slide with a lot of plasma cells, and so what the question is, what blood cells are being assessed. Then finally, I think, so then once we have, this is an exam, usually about 60 minutes or 60 stations, and we divide them according to the weighting. And anatomic pathology now is given, you multiply by the percentage, so that you have a mark at the end, and total I mark will be out of 50. And practicals contribute about 10% of the I mark, and also 10% of the cut marks. So in summary, practical exams are considered gold standard for assessing laboratory skills, competence in preclinical years. It's associated with minimum opportunities of plagiarism. Cheating is usually minimal because these are stations, and each student has about 5 minutes to look through the station and answer questions. And then using traditional practical methods are good. I think it is useful, it's helpful, but using objective structured practical exams is better. I think that was my last slide. My references are listed there. I will not go through all of them. Thank you so much. I would like to acknowledge the Faculty of Pathology in Moi University, Anatomic Department, Immunology, Biochemistry, Hematology, and Microbiology, then the Dean School of Medicine. Thank you so much.